My name is Laura Hegwar, and I'm 49 years old. I live in Lake Bluff, Illinois, and I'm a healthcare rater. I've been doing that for the last 25 years. I was about 46 or 47 when I first started to notice the pain in my hip and at my groin area, and it was on the right side, and it would pop up after I worked out or after I went for a walk. I really started to notice the pain escalate in 2019. And we were in Steamboat Springs, Colorado for a Labor Day weekend trip. I went with my friend and started to go on this trek, and I just couldn't. The hip was just not gonna have it. At that point, I realized that it was really time for me to get this checked out. I couldn't keep going on with this any longer. I started out with having spinal injections. That didn't do anything. Did PT, that didn't really help. Then got a cortisone injection in my hip, that didn't help. And finally had an MRI on my hip. And that revealed the diagnosis of end-stage osteoarthritis. And I was really floored when I read the report, because what they found was that the cartilage in my hip was completely obliterated. Dr. Nam was really the first physician that I saw who gave me a reason for why I had end-stage osteoarthritis at 49, or even a little bit earlier. And he said it was because of hypermobility. When I was younger, I was always one of those kids at the party who could put her feet behind her head, and I've always been really flexible. I did a lot of yoga when I was younger. I didn't think that would be any kind of problem or would predispose me to arthritis. I was interested in seeing Dr. Nam because he had an excellent reputation. And also, he's one of a select group of physicians who offers robotic-assisted hip replacement.
Well, robotic hip replacement is when we use a robotic-assisted arm to help prepare the surfaces of the bone to receive the total hip replacement. It helps us guide the implants into the appropriate position based on the plan that we set for it. It's really the most accurate and precise way of putting in our total hip replacement implants.
And I had a CT scan here at Rush. And Dr. Nam used that CT scan to build a 3D model of my hip so that he knew going in what kind of approach, what kind of implant would be right for me. And that was important.
Most patients, when I present to them the option of a robotic hip replacement, they really are enthusiastic about it, and they like the idea that I can truly be more precise and more accurate about where I put the components during the surgery. If your surgeon has a plan and says, I want to put the socket in X and Y position, the robot will allow you to achieve that with excellent precision and accuracy. With conventional techniques, there's a lot more room for error. That being said, even with that room of error with conventional techniques, total hip replacements do very well. And I think that what we're trying to learn is how we use this increased precision and accuracy with robotics to our advantage to make sure that patients are doing better in the long run.
The fact that I was opting to have surgery during the COVID pandemic, I was concerned about spending any extra time in the hospital. And I wanted to be able to recuperate at home. It was a quick procedure, and later that morning I woke up in recovery, and I was a little disoriented. I was still kind of groggy, but I felt fine. I didn't feel any pain. They gave me a walker, and I started walking around the recovery room doing a couple laps.
As you go through recovery, you will have some soreness, you'll have some achiness, and as you go through physical therapy, that's to be expected. But our expectation is usually by about 4 weeks after the procedure with physical therapy, patients should be walking really well without assistance, without a cane, and really with minimal pain in the hip at that point.
I had 2 crutches, and I used those crutches for the first week of my recovery. Then I moved to 1 crutch after 1 week. Then by the 2nd week, I was just using a cane. And then by 4 weeks, I was able to walk completely without a cane to my favorite coffee shop. And that was a 1.67 mile walk without anything, which felt great.
I just saw Laura for her first follow-up visit, which was 3 weeks after her surgery, and she was doing fantastic. Minimal pain in the hip. She was walking well without any assistance. She did have a little bit of a limp. That's asking those muscles to do some activities that they really haven't done for years because she was so painful and really not using the hip in a normal fashion. So she's working with physical therapy right now. She's doing excellent, and we anticipate that she's going to do really well from now into the future.
No one wants to be told that they need a hip replacement. I've been really pleased with the fact that I don't have the pain anymore. To not have that pain that I had for so many years that I really felt was holding me back from doing the things that I wanted to do. It's miraculous. I feel this sense of renewal and hope that I haven't felt in a really long time.